Digoxin is a beta blocker antiarrhythmic that inhibits the sodium-potassium ATPase pump, which allows for more calcium to supply strength for the heart. It decreases both the heart rate and the conduction speed, relaxing the vessels. This medication has a narrow therapeutic index, which makes greater space for error if not careful. A loading dose is often given to bring serum levels to a therapeutic level rapidly. Its half-life is 36 to 48 hours, which can be increased with renal impairment and is excreted by the kidneys.
The uses of this drug are known to treat heart failure and correct irregular heartbeats, arterial flutter, and paroxysmal supraventricular tachycardia. Side effects of digoxin can include dizziness, headaches, nausea, abdominal pain, anorexia, confusion, disorientation, fatigue, hallucinations, hypertension, bradycardia, vomiting, loss of appetite, and diarrhea. Some adverse reactions that are unplanned of digoxin can include dysrhythmia, weakness, vision and mood changes, and tender enlarged breasts in men.
Allergic reactions are rare to happen, but if they do, you'll be looking for a rash, itching, swelling around the tongue or throat, difficulty breathing, and symptoms of extreme dizziness. Contradictions include hypersensitivity to digoxin, ventricular fibrillation, ventricular tachycardia, and known alcohol intolerance. Teach the patient and or caregiver taking the medication at the same time every day is important, and to take missed doses within 12 hours of the scheduled dose or do not take it at all. Do not double doses or stop medication suddenly. You need to know how to take a correct pulse reading of your apical pulse for 1 minute. If the pulse is less than 60 or greater than 100, call the physician before taking the medication.
Avoid the use of over-the-counter medications, herbal remedies, and do not take with antacids within 2 hours before or after you take digoxin. Seek medical attention when experiencing any abnormal side effects and if you have any concerns. Digoxin can come in an oral tablet, IV, or IM form. When administering digoxin, you need to know the rights of medication administration and to always do your 3 checks. You cannot take this medication if your pulse is less than 60 beats per minute.
Taking the medication orally, a patient that is older than 10 years of age can have a total of 10 to 15 micrograms per kilogram in 3 divided doses, with the first dose being the loading dose that will equal half of the total dose of the medication to be given. Each dose can be given 4 to 8 hours apart. The onset is 30 minutes to 2 hours with a peak of 2 to 6 hours and a duration of 3 to 4 days. If the patient has difficulty swallowing, the tablet can be crushed. IM injections are not recommended because of the pain that it causes for the patient. If you could not take orally, please refer to the IV method. A patient older than 10 years of age taking the IV dose is equivalent to 12 micrograms per kilogram divided into 3 doses, with the first dose is used as a loading dose and it is equal to half of the total medication to be administered. These doses should be every 6 to 8 hours, and the onset is 5 to 30 minutes with a peak of 1 to 4 hours, and the duration varies.
Check the apical pulse for 1 full minute. If it's less than 60 beats per minute, hold the medications. Lab tests should be preferable taking this medication to monitor blood serum levels to obtain a therapeutic response. Observe the ECG continuously during parenteral loading dose. Monitor input and output and weigh the patient daily. Observe any edema that could be presented as well as abnormal side effects.
Created using Powtoon.